daytime enuresis, or never were potty trained or regressing or for kids that have daytime potty training issues, we can do a potty timer where they have a watch. They wear a watch and it tells them to go to the bathroom. So it prompts them to go to the bathroom on a routine schedule. Kind of like trolls and their hug watches. Like hug time. This is the potty timer. Okay. And that's what we do. They have an increased risk for abuse in these children with their problems with potty training. Kids do best with routines. Okay. Any questions on enuresis? Again, it's more behavioral than anything. It's usually not a physical issue. They may have to go to urology if it's a continuous issue, but their primary care doctor, they need to talk to their primary care physician about problems. If there's further, but this is not our problem. Our problem typically is about normal kids with normal problems. If they're going to be referred to urology, then it's a whole nother animal. Medication-wise, there is one medication that we can do at the last resort. Anybody know what that is? It is a medication we use for SIADH. We use desmopressin because it retains urine. So we give it PRN before bedtime, low dose. It just keeps them from peeing overnight, and it wears off by morning. Desmopressin is used like a twice a day medication in SIADH or DI. Well, it's desmopressin. It retains their urine and it doesn't cause any other issues, but it's a last resort. We usually have to try everything else before we even think about prescribing a medication for bedwetting. But it is not impossible. It works, but we should never lead down the line toward a medication immediately, ever. But I don't want to say like you've never heard of it. Okay. Now we're moving right along. This is good. Any questions on enuresis or reflux? No, I think they're pretty straightforward. UTI in pediatrics. UTIs can happen in peds, and it happens often enough. When infants come in with fevers, we typically suspect urinary tract infections. But what is the most important part about urinary tract infection in pediatrics is preventing. The test questions tend to run toward prevention in urinary tract infections. It is the same as UTIs. It is infection of the bladder and diagnostics. We do urinalysis, and we're going to see increased bacteria, lymphocyte count, nitrates. That it's exactly the same diagnostically in adults. It causes fevers in kids. They have burning with urination. They have darker urine. They have different colors. they have pain with urination, it's exactly the same. But there are differences in prevention, okay, for pediatric urinary tract infections and adult urinary tract infections. Some are similar, some are different. And why do infants have this easier time of getting urinary tract infections? It's because physiologically, they're smaller. They have a smaller body. And so the holes that, their anus is closer to other parts of the body, so it can get contaminated very easily. So prevention measures for diapers always is, especially if they're girls, like front to back. Right? I mean, I hate to be obvious, but it's obvious. What else is there? Intervention-wise. Hold on. I'm just thinking for a second. We have, I remember now. Avoid bubble baths, even in adults. In children, we want to avoid bubble bathing or baths in general, because you're basically putting in a soup of dirty water, which can go up into the urethra, males or females, and cause urinary tract infections. So again, avoid bubble bath. If they're out of diapers, underwear is safest. Something breathable. Okay. What else is there? And just like adults, we have teenagers. Remember, teenagers are also in our category of pediatrics. If they're going to have intercourse, they need to pee after. And that is sometimes shows up on some of the exams, as in a select all to apply. What are some preventative measures for preventing urinary tract infections in pediatrics? Do not forget that teenagers have adult tendencies. We should say that. There really isn't a lot to urinary tract infection, really. It's the basics. Yep. Okay, moving on. Let's take we're gonna need a 5-minute break. I need to go to the restroom. 5-minute break. We'll be back real fast. We'll make it a 10-minute break, and we're gonna finish up with acute glomerular nephritis. I know we want to finish it now, but I gotta go to the restroom. Give me just a few minutes.